Welcome back to another episode of An Unexpected Fight. Today we're going to sit down and just talk. Kelly, Amber, and I are going to go over some of the intricacies of pediatric cancer, and let's get into it, girls.
So I'll start. I think one thing that people don't realize about pediatric cancer is how common it really is. The government likes to title it as rare, but 43 kids a day, at least, I think that number has actually grown a little bit, are diagnosed with pediatric cancer, which is an entire bus full of kids.
That always baffled my mind about how rare people say it is, but I think that it isn't looked at enough. I think people turn their heads because they don't want to see it. They don't want to see kids going through that because it's hard. And whenever they turn their blind eye to the problems of society, I think we're making things worse because we're not working on how to fix it. For example, I walked in Walmart the other day and guess what's already out?
Breast
Breast
cancer.
cancer t-shirts. I'm like, it's only August and we're just going to forget about our kids. Pediatric cancer is awareness month is September. Who all knows that? Nobody, because no big propaganda has gotten big box stores on board with pediatric cancer.
Absolutely.
I think I really
definitely
realized.
Nope.
I was going to say, I think I really realized that the rarity was a lie whenever I realized that I think Miranda made the third little girl in Arkansas with AML that like they were all the same age, they were all diagnosed around the same time and being treated at the same hospital. And she was the third one. And I was like, but this is so rare. It didn't make sense to me. And I think that was when I really was like more into like I think that was when I really got more like wanted more knowledge, more of the facts and the statistics, digging into that on my own.
Absolutely. I mean, it's the same with our story. When Riley was diagnosed, I heard, oh, we hardly ever see this, and especially in infants. But as we've been through this journey, I can't tell you how many kids we've met with glioblastoma. I've lost count at this point. So, they say it's rare because I suppose when you're comparing it to breast cancer or lung cancer, or let's go outside of the cancers and compare it to like diabetes and heart disease, there's so many people being affected by that daily. That's something that, this can get a little controversial, but that's why there's so many medications, for instance, for diabetes and heart problems and breast cancer drugs. There's like new ones popping out every week. But I think it's something like in the last decade, what have we had, Tiffany? Like 4 drugs developed for pediatric cancer. That's it. And there's thousands in comparison for the adult cancers. And it's because the way we're looking at it. But Tiffany and I did a podcast recently with a really amazing researcher who I think is really going to put out some groundbreaking research, Dr. Kai. But he stated that if you looked at it differently, if our government looked at it differently, and really just anybody, if you, instead of looking at it as how many kids per day, if you looked at it as the amount of years lost, it's something like 70 potential years are lost when a child's diagnosed with cancer, because the average age is like 8 to 10. And so there's like 70 plus years ahead of them that they're losing. And if we were to focus more on that fact, I think that there would be much better treatment options and people would be fighting for it, versus just looking at like, okay, it's only 43 kids versus thousands of people with all these other diseases. But these other cancers and diseases are often diagnosed in like your 60s, your 70s. So I wish that's how people really kind of focus on it.
Yeah, I looked up some statistics on this. So the average age for the 4 most common types of cancer of diagnosis in adults. So breast cancer, average 62, prostate 66, lung 70 years old, and then colorectal 68. So if you look at the average life expectancy of 80 years, you're looking at anywhere from, 5 to 10 to maybe 15 years of life lost, where a child gets diagnosed, you're looking at 70. And then if you take how many children die annually in the United States from pediatric cancer, it's 2 to 300,000 years of life lost
Wow.
in children every single year for what? Because we don't want to spend the money to delve into research because there's not enough children with cancer, but why did their lives not matter?
Exactly.
You know,
That's
I
another
talked to
thing.
one of my patients the other day about, I said, if we could only live our lives in reverse, right? What you know as you're born as an adult and then you lose knowledge over time instead of having to gain it. And I feel like these adults have gotten to live their life, and it's not fair for kids to not get the same opportunities.
That's another fact that surprised me is like when we were in treatment, we were talking about the chemotherapies that Riley received. They were from the 1950s, 1970s. And I was like, this is mind boggling to me. And then I would meet other families with kids who had a completely different tumor and they were being treated with the same medication. So instead of like a targeted therapy approach, which we'll get into more, I'm sure, they're all getting this similar chemos, and there's 120 different types of pediatric cancer. So why are we treating them the same? Every tumor is different and every tumor is unique, but we're like, well, let's just throw this, ancient chemotherapy that we know is toxic at these kiddos.
I think the reality of life as a cancer parent is something that's hard for other people to grasp. And seeing how these outdated medications affect children. Colton had to go through immunotherapy that he needed to save his life, but he was extremely allergic to. And so, on the one hand, you don't do it and his life could be shortened, or you do it and that by itself can, be the end of his life. And I think that people think that because I know I did. I think people think that chemo is just chemo. I don't necessarily think that people realize that there's different kinds and that we need more. I think that people just hear the chemo and it's all the same to them.
Absolutely. And you're right there. Yes, on one hand, you're trying to save your child's life, but these toxic chemos we're giving these kids are causing secondary cancers. They're causing heart problems, lung problems. When I had to sign the paperwork that said, do you want to treat Riley with these medications? Here's the side effects. The list of side effects was an entire notebook full. And, we're very fortunate that she's here. And every day feel extremely grateful for that. But there are some days where I feel like we're walking on eggshells because we're waiting for something to pop up, like waiting for, okay, is she going to start having lung issues? Every eye roll that she does, she has motor tics. So every little tick that she does where she kind of spreads her hands out, I'm like, are we seizing? Like, what are we doing? And you shouldn't have to think like that. But knowing the really toxic regimen that we treated her with to save her life is terrifying in itself, because you don't know like what kind of issues they're going to have later on. And I think a lot of our kids, is 95% of kids treated with chemotherapy or radiation, develop lifelong side effects. And that's a huge number.
Yeah, I think I read something that said 60 to 70% of children have at least one chronic severe health condition. And they reported that the average age of development of that was around like their mid-20s. And then 27% of those have life-threatening complications from their chemo, not to mention all the children that I've seen that have died from complications while they're getting treatment. I think it's a lot more common with kids with leukemia, just because their immune system's already compromised with cancer, and then you give them chemo and then they have no immune system, and then infectious opportunities arise and they're hard to treat at that point.
Oh yeah, we were
When
treated during COVID times, and I was a nutcase. I like literally wiped down with Lysol wipes, which also probably have carcinogens in them. But I thought it's better than bringing in a virus. I was like wiping down our shipped like delivery, like groceries, because Riley was a baby, so she'd grab her squeezy pouch from the outside and then like lick her hands and whatever kids do. And I was literally like Lysoling like our food, our groceries, everything, because I had read the statistics for kids being in treatment. Sometimes they end up passing away due to the flu virus or something that any other, something that most parents take for granted because it's just a virus for most kids. But for kids being treated with cancer, it's lethal. And that was terrifying. So I became a little bit of a germaphobe at that point in my life. And now my girls still ask for sanitizer when we go places.
One of the little boys that we have on Nora's Warriors was recently diagnosed with AML secondary to his original cancer. And he got a fungal infection. And I was reading through the comments and, people not understanding. And so reached out and, was just kind of educating people, that fungus is everywhere. We all breathe it in and come into contact with it all day, every day. But for a child going through treatment with no immune system, that same fungus that you come into contact with every day could literally be the end of their life.
That's so scary. I mean, these kids don't deserve to have to live in a plastic bubble their entire life. I think the last time that I looked, in 2022, 90 new drugs were developed in that year for adult cancer. And for kids, there's only been 10 drugs in the last 4 decades. So why are we not studying more, developing more? We're using so many more targeted therapies now in precision medicine in adults, but for some reason, kids aren't being tested as much. They're only testing them at relapse or refractory, meaning that their disease didn't go away after their initial treatment. But over the past decade in adults, we've learned that when you do these tests, you find these targets and then you can develop the drugs on the back end. And so I don't understand why these kids aren't being tested. So, any parents that are out there, if you have a child with a cancer diagnosis, make sure that your child has had next generation sequencing done on their tumor tissue, because this is going to give us information. Even if it doesn't help your child right this minute, it may help the next child, or it may help your child down the road if they were, God forbid, to have a relapse of some sort. So, just making yourself aware of what's out there, and you have to kind of cross reference some of these things because you see all the stuff that's being done in the adult world, and you would think that, oh, they must be doing that for kids too, but they're not.
Yep, absolutely. That's where like smaller foundations like Nora's Warriors, who is now partnered with National Pediatric Cancer Foundation, that's where we come into play. And that's where, we're trying to kind of bridge that gap, because it's 4% of government funding, maybe a little more than 4% now. I read the numbers are a little wishy-washy, but somewhere between like 4 and 8% of the government funding of cancer research goes towards pediatric cancers. So that's where, some of these smaller foundations are important. And if there's anybody out there who's either getting ready to start a foundation or, already has one, but they don't know where to put their money, reach out to Tiffany or I, because that's one thing. I got like 17 blankets when Riley was diagnosed, and it was very thoughtful and it was very nice. But at one point I thought, man, if all these small foundations, instead of, donating blankets and teddy bears, which are beautiful, don't get me wrong, if they were to kind of come together and put all that money into one space, maybe we could fund a whole nother trial, and that whole nother trial could save so many lives. So that's something that Tiffany and I are also set out to do. So reach out to us if you're at all interested in either starting up a foundation, doing some fundraising, want to get involved, because the National Pediatric Cancer Foundation puts 89 cents of every dollar straight into the trials that we're working on. And I can also kind of help facilitate and help find trials for families who are potentially looking out there. So please reach out to us.
And I'll add to that, one thing about why I chose to partner with NPCF over the thousands of other organizations, and especially some of the large ones that people think of. And don't take me as knocking these foundations. I'm not knocking them at all, but I do want to make our listeners aware of where your money goes and what you're putting your money into. Like American Cancer Society donates less than 1% of their earnings to pediatrics. You can go online and look up all of any nonprofits tax documents so you can see where they put all their money. Now, granted, it's a little hard to decipher some of these documents because they're like 100 pages long and they're a little convoluted, but you need to be paying attention to where you put your money, because a lot of these large organizations, a lot of it is not going to what you think it's going to. It's going to pay salaries. It's going to pay for marketing. It's going to pay for, things that are totally unrelated to what you're putting your money into. NPCF has all of the highest charity ratings. They make sure that their money is staying where it needs at. Now, do we make money? Do the people that work at NPCF make money? Yes, but they also work with a skeleton crew. They're not using all of these different employees to get their work done. They literally work with a handful of employees that you can count on your fingers and toes for an extremely large national organization. It's crazy that they get their work done. I mean, honestly, it really is, because they do so much work and it's difficult, but their mission and the missions of the employees and the people that work there are to put money into research. And so that's just the biggest thing. And another thing about research is clinical trials. So I have a lot of families who say, oh, my child had this or that, and I only want my money to go into research for this particular cancer. But I'll tell you why I don't restrict the funds that I raise to ETMR or just brain tumors. Because as I've seen in adult oncology, new drugs are developed and then they can use them in many different tumor types. So if you go in and say, oh, I only want my money to be put into so-and-so, well, that sarcoma drug may not work, but you may have a drug that's being studied in neuroblastoma that ends up working for sarcoma as well. And so I think it's important to understand whenever you decide where to put your money, when you're looking at research and you say, I only want this to go to XYZ. Think about that for a little bit, because you may really be limiting the research that could be done to potentially save a child's life, not just a child with the particular cancer that they had, but it could be saving a child with 10 other different kinds of cancer. Because when Opdivo was developed, for example, the immunotherapy that you see all over TV, or Keytruda, those were both very specifically studied for melanoma and lung cancer. And then now you can use both of those drugs in any oncology patient. I mean, these are available across the board for all tumor types, especially with certain genomic alterations. So I think it's important to know you can fund research of any type as long as it looks credible. You know what you're putting your money into, and you can say, hey, I'm going to donate to NPCF, but I only want this going in the research pot. Meaning, like, you don't want it to go to any administrative things that need to be done within the organization. You can do that. So it doesn't just have to be so restrictive, but do know that it does take people working to be able to get these trials done, to get this research done. And so, I used to think, oh, I don't want to be paying some big CEO salary, but that CEO is who's keeping this organization running, who's keeping these clinical trials going, who's obtaining these doctors who are going to do this work. So, just just a little bit about clinical trials and funding and something to mull around a little bit.
And I think a lot of it starts with awareness. I think the three of us, that's something we have in common is we want to spread that awareness. There's so many facts about pediatric cancer that people don't know. I thought, even being a nurse and you always heard that 85% of kids survive. And you're like, oh, that sounds pretty, that's promising. That's good. But it's really not true because they're looking at the survival as a 5-year period. So they're like, okay, at the 5-year mark, we see that 85% of these kids are surviving. But I've seen kids relapse, especially in my role that I have at the 6-year and the 7-year. I've heard of kids relapsing at the 10-year mark. And it's hard for me to even talk about that because I have a child who's right around that 4-year mark. And I want to tell myself that we're good and we're out of the woods. But sadly, that's the scary part with cancer. You don't know when it could return. And so that's something else I think people aren't aware. They hear that 85% are surviving. And so there's just not a lot of awareness around it. But in fact, there's brain tumors out there, as Tiffany unfortunately very, very well knows, that have a less than 5% survival rate. ETMR, glioblastoma, DIPG, some of the ATRTs that have different mutations, they have awful survival rates. And then even some leukemias there's some more rare forms of leukemia that have really rough survival rates in comparison to see, there really is no good cancer is what I'm getting at. And I really don't believe that 85% of kids are surviving because that's just not what I'm seeing. I'm seeing that, maybe at that 5-year mark, but beyond that, it's kind of hard to say. And why are we measuring it in a 5-year mark? Because if a child like mine is diagnosed at 10 years, I'm not celebrating at 5 years. I mean, I'm celebrating every day, but at 5 years, I don't feel like, all right, good, we've done it. No, I want her to make it till she's 95, So that's something else that I think that funding starts with awareness. And I think that's why I was excited to do this particular podcast, because I just think that unfortunately, until you're living it and you're a cancer mom or a cancer family, or somebody with childhood cancer and you start looking into the facts, these things are just kind of swept under the rug. And I think it's hard for people to really hear, and it's hard for people to talk about. So I love that you ladies are ready to talk about it.
I think that to kind of piggyback off what you said, I think that it's also hard as far as Kelly, you and I having children that have survived, but kind of definitely at the sake of our mental health. People think that because our children are in remission that our life just went back to normal and everything is just rainbows and butterflies, and it's definitely not like that. I mean, Miranda is getting ready to start the 7th grade, and this will be last year she was exempt from PE. So this year we're looking at doing PE. But there are all of these different things that we're having to explore. And I was talking with another cancer mom the other day, and we were talking about the things that we kind of think should be done for children after treatment that aren't necessarily done. Like, you should just automatically have a physical therapy evaluation, a neuropsych evaluation, just all of these things to see where your child is at, because I didn't know to ask for these things. And so now I'm scrambling because I'm at this place where I'm like, okay, I know that Miranda can do some things physically. Put her in Tiffany's pool and she'll stay there all day long. But ask her to go out on the track and run a mile, and that's probably not something that she can do. And I think us moms are kind of in this weird place where we're kind of like, at least for me, I'm like, okay, how far do I push her? She doesn't like any special treatment So it's really hard because she just doesn't want to be known as the cancer girl. And where I'm trying to get her to realize, like, you had cancer, you fought for your life. It's okay. But trying to navigate this new normal, like you were saying earlier, when your daughter rolls her eyes or, anything, anytime Miranda says she doesn't feel good, I'm like, okay, what doesn't feel good? Like, because that's how with Miranda it started off with strep throat and the flu and then just this not feeling good. And so anytime that she says that she doesn't feel good, like my mom antennas go up and I'm like, okay, what does that mean? Is something else coming? Are we relapsing? Are we about to have some kind of long-term side effects show up? And I just don't think that people realize, they hear remission, they see the celebrations of, you ringing the bell, and they think that it's over and like everything's gonna, but in reality, things never go back to how they were. Like we all just have a new normal. And I don't think that people realize, we're a year and some months past our last round of chemo, and I was excited when we just hit a pretty big milestone of going from monthly lab work to every 3 months, but it's been weird. Like, even Miranda will be like, "It's weird not going to see the doctor, like, once a month," and then you have, like, all of these questions because you're kind of, like, alone, and a lot of the time, your circle of support has gone back to their normal life, and, then you're spaced out with the doctor's appointments, and so you're kind of left on your own with, "Okay, what does this stomach ache mean today? What does this headache mean?" Or, all of those things that people just don't think about. And I know that Miranda was given the opportunity to be on a clinical trial. And that is the course of treatment that we ended up on with the lottery that she was put into. And one of the more common side effects with AML treatment is heart issues. And so one of the things that this clinical trial was trying to do is lessen the effects on the heart. Well, because maybe I would have thought this way anyway, but because of all of the talk about her heart and the effects on her heart, for me, knowing that her heart is a muscle and you can be tired if your heart's not functioning properly and all of those things, anytime that she's like extra tired or she gets out of breath, I'm like, okay, is something wrong with her heart? Like, what's happening? Do I need to take her to the doctor? But nobody talks about those times and those things. Like, they just think, okay, Miranda's, healthy, she's doing great, life's back to normal. And really, it's just within my what I call my cancer family. Tiffany and I've gotten really close. I've gotten close with some other moms. Like, those are the only people that get it. Everybody else just expects us. And don't get me wrong, I am extremely grateful that Miranda is alive and currently healthy. But that's also what I always tell people, is that she is currently healthy. That could change tomorrow.
100%. I want to circle back to what you're talking about with like how it started as like just a cold or a virus, or so they thought, strep throat, because that's something else that happens a lot. I think it was like 75% of kiddos who are diagnosed with cancer it's already metastasized by the time we find it. And that's a tricky one. I was very upset initially when Riley was misdiagnosed because we were diagnosed with a stomach virus. She was 10 months old. She couldn't tell me what she was feeling. She just had some vomiting that started out pretty intermittently. A couple days in, it was a little more violent, and I called our pediatrician, took her in. They looked her over. Everything looked fine. So they diagnosed her with a stomach virus and sent us home. Less than a week after that, she was seemingly getting better until she fell over and lost consciousness. And that's how we found her brain tumor. And we had emergency surgery that night, and it was just go, go, go from there. Within 2 weeks, she had port, she was starting chemo, but we were misdiagnosed. And I was a little, initially, I was upset with our pediatrician. How could you not be? I'm like, I get it. I'm a nurse. I also wasn't thinking brain tumor. I don't think really any parent goes to cancer when their kids are feeling sick initially. But I did think in my head that I did mention that my gut told me something was wrong on more than one occasion. And that's when I think our team should have said, okay, mom's telling us her gut is feeling like something is off with this child. So, for any cancer moms who are listening, always trust your gut. Really, any mom with any type of illness with a child, if your gut is just saying, this, my child's not acting right, even if you can't pinpoint it. And that was the problem with us. We couldn't pinpoint it. Other than the vomiting, everything looked good. She was learning how to crawl. She was pulling herself up on tables. She seemed like a normal, healthy baby until she wasn't. And I feel like that happens a lot. It starts with virus symptoms. And that's the thing with kids, right? They get sick all the time. So these pediatricians are used to 99.9% of the time, it is just a virus. And so their mind is like, it's just a virus. But for any pediatricians that happen to pop in and listen, if there is a mom that's saying, listen, something is wrong here and I don't think it's a virus, what is a little extra testing going to hurt? I'm not saying that every kid needs to have an MRI, and I get it. I get where the holdup is with doing all the extra testing because number one, it gets costly. Number two, you don't want to put a kid through an MRI machine if you don't have to. But when, it's just not adding up, you maybe dig a little bit deeper. So for us, the first thing I said was nobody else in the house is sick. When have you ever seen a stomach virus roll through and only affect one person in the house? The other red flag was her vomiting was more severe right when she woke up in the morning, which as a nurse, I beat myself up for a few days and said I should have known because when you're laying flat, you have increased intracranial pressure. So vomiting in the morning is a sign of increased intracranial pressure. I should have known that. But again, I was thinking like a mom who was exhausted with a 10-month-old, not like a nurse at the time. And hindsight's always 20/20, but I think that always listen to mom. If a mom says, or any parent says, my gut is just telling me that there's something off with this child, stick with that and keep fighting and advocating because we definitely know best. And yes, as far as post-treatment goes, it does not just go away when their hair grows back. Cancer's not just gone, we're good to go. I will say I am hopeful. There are some survivorship clinics popping up throughout the country. We go to one now, so we take Riley once a year to a survivorship clinic, and we have an incredible oncologist who went back and studied integrative medicine in addition to oncology, and she looks at all the things that like she was talking about when she gets a little older, we'll keep a close eye on her hormones and we'll do this and we'll do that, and she's looking at the big picture. But not every hospital has a survivorship clinic yet. So hopefully we can get some more of those because you're 100% right, Amber. You're not just done, it never just goes away. Something you have to live with.
I definitely think survivorship clinics are needed all over for kids. I mean, there's a lot to navigate and go through. I was going to touch on, obviously we were misdiagnosed as well. Took a lot longer to get our diagnosis because Nora didn't have vomiting, which is a more classic brain tumor symptom. But whenever I originally took her in, the first thing I told Jeremy whenever he was like, hey, have you seen Nora's face? Like, it looks like one side of her face won't move. And whenever I eventually saw it, I was like, this is bad. I was like, this is a brain tumor or Bell's palsy. And she got misdiagnosed by a double board certified pediatric neurologist. I mean, it happens a lot. And I'm working here with some of the pediatricians. Zane's pediatrician, Dr. Cannon, I actually interviewed her like on my very first podcast episode. She's amazing. She's diagnosed several kids in the community. And, one thing that we talk about a lot is whenever you take your child in when they're sick or for a physical exam, make sure your physician is touching them. make sure they are listening to their heart and lungs, pressing on their belly, looking at their genitalia. And yes, it's uncomfortable, and a little bit older child is not going to like that. But she and I have talked about how important that is. I'm sure Audrey won't mind me sharing about Colton, but Colton was having a lot of severe abdominal pain, and his pediatrician never touched his belly. Takes him to the ER at Children's. They touch his belly, immediately know he has an abdominal mass. Like, we have to make sure that we are holding accountable our providers, especially whenever, and I'm not saying, if they tell you something, don't believe them, because they've been trained, they've been to a lot of school. There's a lot of great providers out there, and I'm not talking bad about any provider. I mean, that could have been missed by anyone. But, the facts are, is as patients, mothers and fathers and caregivers, it's also on us to make sure that our children are getting the care that they should be getting. And it's okay to say, hey, are you not going to do an exam, make sure that everything's good. So I think that's just something I feel really passionate, and because Nora was the same way. She didn't have any loss of milestones. She had a facial droop. They kept asking me, how's she doing? I'm like, well, I mean, she's fine. She's acting normal. She's playing normal. But then, 4 weeks goes by and everything's progressing. And I take her to the hospital and she's still doing normal baby things. And the doctors are saying, there's nothing wrong with her. I'm like, no, there's something wrong with her. And I put my foot down at that point. I said, you will do an MRI or I'm not leaving this hospital. I mean, and then clearly we got a devastating diagnosis that could have, we could all play the what if game. If she would have been diagnosed the first time I took her in, would she still be here? And the answer is maybe. Maybe she would still be here. But I have to remind myself at what cost, would she have any quality of life? And this, anyway, that's a whole another podcast. But
I think that
I think,
the
like Kelly said, neighbor said,
I think that the mom gut, the mom intuition is so important. And also knowing as a mom, it's okay to push back. Like, your child. And if something doesn't feel right, it's probably not right. We were not misdiagnosed, but it took some pushing because Miranda had strep throat and then she had the flu. And I remember calling the after hours number at least twice, maybe three times, and just like explaining her symptoms and just feeling like something was wrong. And our clinics after hours is actually answered by Arkansas Children's Hospital. And, when they would find out that she had strep throat and the flu, they were like, well, it's probably just her body recovering. But I remember that week of Thanksgiving because she'd missed like all of November already from school, but really like paying attention to her that week of Thanksgiving. And I remember telling Johnny, if she is not better when everybody goes back to school on Monday, I'm taking her to the doctor because something is wrong. And thankfully, I called on Monday. I wanted to get her in with her doctor, and her doctor, Dr. Hardy, is fantastic. And she actually listened to me. And the cancer was never mentioned. Mono was mentioned. She had all the signs of mono. But Dr. Hardy said, let's do some lab work. I agree that, something's wrong. And she was actually the one to call me less than 24 hours later and tell me that, the outside lab had called and that it looked like Miranda had leukemia. We needed to go straight to Arkansas Children's Hospital. But it was that mom gut and that pushing back that, if I hadn't done that, it so what I was told when I because AML isn't like staged, I asked like, how long has she had this? And the only thing they could really tell me is that they've seen kids come in a lot sicker than her. And so they were hopeful that we had caught it early. But if I hadn't listened to my mom gut and I hadn't pushed back, it might have been a different story. And it sounds like that's a common thing. Even Tiffany, as you mentioned, Audrey, like we've all had to push back. And I think that yes, the providers are trained, but maybe they need a little bit more, not necessarily training, but just listen to the person who's with this child the most when they say that something's wrong.
I had a lot of pushback during treatment too about whenever I would tell them things were wrong. They're like, this or that. And on 3 different occasions, they had to come apologize to me about what I was trying to tell them because they didn't want to hear, what I had to say. Because while a lot of people are lay in the medical field, they don't know a lot about medicine or about cancer. I was like, I do. And I think they just thought I was trying to act smart or whatever. But really, like, I see this day in and day out. Like, I know that there is a bigger problem here. But, it just sometimes is what it is. But I think that we could probably go on and on about all kinds of things in cancer. And we're thinking we may make this a regular Cancer Mom Talk series on the podcast. So I hope you guys all have enjoyed listening.
Absolutely.
And I've enjoyed talking to you guys.
Let's do another episode. I'd love to touch on how cancer affects not only the patient, and we've talked a lot about parents and moms, but also siblings and the entire family, your entire community, your support network. And we talked about maybe touching on some myths and some, things that are not necessarily accurate. So let's plan on recording another episode. And thank you all for listening. I really appreciate it. If anybody listening in needs some extra support and guidance navigating pediatric cancer diagnosis, please reach out.
You can also get involved with the National Pediatric Cancer Foundation through fundraising, volunteering, promoting awareness, or contributing to pediatric cancer research. Just leave a comment or reach out to us via our contact links in the description. Until next time, keep fighting the unexpected fight.